Hi everyone, this is Dr. Aditya Nimbkar welcoming back every one of you after a long hiatus. So today I am back on Magnum Opus Homeopathy to teach you all a very important topic. Now, why do I say that this is very important? Before I continue, let me just check whether the mic is working. Yes, it is working. Yeah. So why do I say that it is very important? Now, the latest census that took place was in the year 2011. And when I say it was taken in 2011, it means that the data that is circulating today is, I mean, the data of the population that is circulating today is almost 14 years old. But in that census, they had shown that the average female life expectancy in India had increased from what was in the mid 60s to the early 70s now. So basically, an increase of almost 8 years in a span of 10 years. As in 2001 का जो census था, and then the census that we had in 2012, we almost had an increase in the life expectancy by almost 7 to 8 years. Now, what is the importance of that and why has this happened? A basic reason is that the age expectancy of even men increased. And the reason has been we have been getting better healthcare. People are earning more. There are more, what do I say, awareness initiatives. Social media has increased the awareness regarding various conditions. And a lot of factors have gone in to ensure that we have gotten just a little more age to our life. But as good that it may sound, ki wow, the women of our country are living a lot more than they did before. And now, given that the next census is going to be in the next year or probably this year, the expectancy is something that I believe is going to increase even more. That is my belief. I believe it should be somewhere around 75 this time. So the problem that women are going to now face is that they are going to spend a lot more of their life in a phase called as menopause. So if I'm going to talk of menopause, सबसे पहले I'm going to discuss what is the definition of menopause. So menopause is a retrospective diagnosis. When I say retrospective, I intend to say that it's a diagnosis that is made in hindsight. I look back upon a period of 1 year, and when the female tells me that she has not menstruated for the last 1 year in her fifth and sixth decade of life, that is when I say that the female has achieved or reached her menopause. So, 1 year of secondary amenorrhea is what is menopause. That is what is the definition. Now, remember, of course, when I say this, you have to rule out things like pregnancy. Then only, obviously, but also I just mentioned that in the fifth and sixth decade of life, pregnancy is very unlikely in that age because of more spontaneous abortions. Anyway, so the average age of an Indian female at the time of her menopause, average Indian age is around 52 years. But 52 years पे average बोल रहा हूँ. The usual range is going to be from 45 to 55. So assuming now that the average life expectancy increases to 75, so for a female who achieves her menopause at the age of 45, she is almost going to have 30 years of her life in menopause. And for a female who achieves, let's say, her menopause at the age of 55, she is going to have almost 20 years of her life in menopause. So almost 20 to 30 years of a lifespan is equivalent to, what do I say, more than one third of their lives, almost a half of their life is going to be spent in a phase of menopause. So what is the problem that menopause brings along? Now we have read the basic ovarian cycle wherein every month we have a dominant follicle, we have a few other follicles surrounding it, and in that scenario, with every cycle, the ovum or the ovary rather is depleted of its ova. And as and how the ova keep getting depleted, by the time a female reaches a menopause, all the eggs, all the ova are depleted completely from the ovaries. So basically, the ovaries are depleted. Ovaries have no ova left. And when there are no ova, there is going to be a cessation of secretion of estrogen and progesterone. So estrogen भी नहीं बढ़ेगा मेरे body में, progesterone भी नहीं बनेगा मेरे body में. Now, in this, estrogen was doing several things in a female body, and this absence of estrogen is going to hurt that female body significantly. It is going to hurt her body a lot, and dare I say, that is what actually the menopause is. The female bears the brunt of lacking estrogen in her body. So, there are several things that happen in the body. I'm going to talk about four major syndromes today, and there is a format that I'm going to follow. I'll tell you what the format is. There is one more concept that you need to remember, that just like granulosa cells secrete estrogen and corpus luteum secretes progesterone, the theca cells secrete testosterone in some quantities. So even females have testosterone and men have estrogen. It is just that the predominant hormone or the dominant hormone happens to be estrogen in females and testosterone in men. You would ask me, what is the use of testosterone in a female? The use is it brings libido to the female. What is libido? Libido is sexual drive. So sexual drive is achieved or is brought to the female by the presence of testosterone in her body. So when I say that the ovaries are depleted of all the ova, it is not just estrogen and progesterone, it is also testosterone that her body is depleted of, which is also the reason why females in their 50s and 60s lose their complete interest in having sex. Now, how do I tackle all these issues? I'm going to talk about each one of them. I just mentioned that there are going to be four syndromes that I talk of and in a format that I'm going to follow. So, what is the format? The format is going to be I shall mention a syndrome. Let us say I mention a syndrome A, just a arbitrary name. So, first I'm going to be talking about what is the actual name of the syndrome. Then I'm going to talk about what are the signs and symptoms of the syndrome. How is the female affected by it? What are her main complaints? Then I'm going to talk about what is the exact pathophysiology behind it. What is the cause of that happening? I mean, estrogen के वजह से हो रहा है is a very generalized explanation. What is the exact problem is what I'm going to discuss in the cause. And finally, I'm going to talk about the treatment. Treatment को मैं RX जैसे लिखता हूँ. Treatment maybe I am going to follow a certain pattern. A few people, or rather majority of the patient, not just a few, first want to experience some non-medicinal method of treatment. मतलब medicines नहीं चाहिए मुझे सर कोई तो बिना medicine का way बताओ बेहतर लगने के लिए. So I shall offer them that. But when these fail, if they fail, then we go for medical management. Or if the symptoms are so severe that I cannot wait upon for non-medicinal ways to act, so तभी जाता हूँ मैं medicinal पे. Medicinal maybe a lot of females, especially the educated females, tell us that sir मुझे hormonal treatment नहीं चाहिए क्योंकि मैंने गूगल पे पढ़ा है hormonal treatment से तकलीफ बहुत होती है. A lot of people have these preconceptions, preconceived notions that medicines that are hormonal can damage their body, which is not really right. But then in that scenario, I cannot force her to take hormonal medicines. So the first option that I'm going to give her is non-hormonal treatment. If this fails, then I will give her hormonal management. And along with all this in medicinal, I shall have मैं red pen से जो लिखूंगा one special drug that I'm going to mention in each syndrome that is very unique to it. So this is how I'm going to be following the pattern of explanation today. So moving on to the first syndrome of the day. The first syndrome, which is in fact the most distressing syndrome on a daily basis. So the name of the, I'll use a black pen for everything else, or let us just use a blue pen here. So the name of the syndrome is going to be vasomotor syndrome of menopause. I am using almost like a rainbowish kind of a color. Not exactly a rainbow, but a multitude, a combined color for writing this because menopause है ही एक ऐसा state जिसमें a female experiences so many things that she is herself confused as to what is happening to me. So vasomotor syndrome of menopause, or what I also will like to call in short as VSM. For the ease of my writing, I'm going to call it VSM. So the first syndrome, the name is vasomotor syndrome of menopause or vasomotor symptoms भी बोल सकते हो. So, what are the signs and symptoms that these women experience? The signs and symptoms include these women often complain of hot flashes. Now, what are hot flashes? These women often tell you that अचानक से मुझे एकदम गर्म महसूस होने लगा, ऐसा लगने लगा कि I am feeling very hot. My entire body is burning. It feels like someone has set my body, especially my face, on fire. And whenever the female feels this, this often happens at night. ये काफी बार night में होता है hot flashes when she's sleeping. What does this lead to? This leads to sleep disturbances. The female is having a disturbed sleep. When she is having a disturbed sleep, she will be sleepy throughout the day when she should be working. So daytime sleepiness. She'll be very tired throughout the day. She would want to grab a nap bar bar. If she goes off to sleep at work, that will reduce her economic productivity. So it is affecting her job. Of course, she has a boss who is going to complain that you're sleeping on duty and you're not working well enough. It is his right to do that. He is not understanding what is wrong with her, but he has to look after the company. And if she's economically not productive, if she is not economically productive, then who else is going to work for that company? But now that the economic productivity is going down, she is experiencing a lot of backlash from her colleagues, from her seniors. She starts having depressive symptoms. उसको डिप्रेशन होना स्टार्ट होता है. एंड ये डिप्रेशन की वजह से जैसे हम आगे जाएंगे डिप्रेशन भी होगा. उसको बार बार ये टायर्डनेस के वजह से सी विल स्टार्ट फॉरगेटिंग थिंग्स बिकॉज शी इज टू टायर्ड टू रिमेंबर थिंग्स. मेमोरी लॉस होगा. मेमोरी लॉस के वजह से हर जॉब इज गोइंग टू बी अफेक्टेड इवन मोर. there is going to be more economic productivity का decrease. And ये सब के डिप्रेशन और ये सब के वजह से she is going to have even more sleepless nights. तो बेसिकली उसका स्लीपलेस नाइट्स का एक विशियस साइकिल बन गया और ये हर बार स्लीपलेस नाइट में जाती है तो इसको हॉट फ्लैशेस आते हैं. सो दिस इज अ विशियस साइकिल that she has set herself in and she starts getting very uncomfortable. What does the body do? The body says that I understand that the body is heating up. The female is experiencing excessive heat from inside. So what do? I will start sweating. So profuse sweating or perspiration is what occurs at this moment. The sweating is to lower the body temperature. If you go out in the heat, your body starts sweating. Sweating is a response to cool down your body temperature so that you don't have a heat stroke or something. So the female is randomly going to start sweating and sweating के वजह से again it becomes very uncomfortable for her. She feels that now I have to again change my clothes. So ये सब रात भर चलते रहता है and it affects her entire day-to-day working. You would ask me, but why is this happening suddenly after menopause? ऐसा अलग क्या हुआ है? So the cause. Now remember that in my hypothalamus, you just know this is very basic physiology. In my hypothalamus that is present in my brain, there is a thermostat. Now, what is a thermostat? Thermostat is basically thermo मतलब temperature, stat मतलब static. Static is stagnant. So thermostat is any device that keeps the temperature constant. Your thermostats are present in your air conditioning systems. AC में रहता है. You have it in your geysers, hot water geysers. So what they do is they maintain the temperature at a certain set level. They keep it static over there. You can reduce it or you can increase it. Similarly, the hypothalamus has its own thermostat, and that thermostat governs your normal body temperature. So every time you have an infection in your body, whenever you get any infection, let us assume you have what do I say? Rhinitis, सर्दी, viral common cold हो गया है. In that scenario, there is a virus in your body. That virus is leading to inflammation. That inflammation is releasing several cytokines. All those cytokines are increasing the body's prostaglandins. One of the cytokine is prostaglandin. This, sorry, This prostaglandin is going to act on your thermostat and is going to derange it. और ये thermostat को derange करने की वजह से your body temperature is going to go up. What your body earlier considered 37 degrees Celsius as normal, now the body thinks that no, the normal for me is going to be 38 or 39 degrees Celsius, and hence the body's temperature increases. What do you do for that? Whenever you get fever during infections, you give a drug called as crocin. Crocin मतलब paracetamol. Paracetamol का काम है COX inhibition. COX का काम है prostaglandins को inhibit करना. The moment prostaglandins reduce, your thermostat is again reset back to normal and your temperature reduces. That is how crocin works. In fact, there is a drug called as misoprostol that we obstetricians give for aborting. If you give misoprostol for multiple durations, or for a longer duration, or for multiple times, if you give that female misoprostol, misoprostol is a prostaglandin analog. It's an agonist. So it increases the body का prostaglandins, and जब increase करेगा thermostat भी मेरा derange होगा और उससे fever आएगा. इसलिए misoprostol से females को fever आता है. So, coming back to the discussion point over here is just like prostaglandins are acting over the thermostat, the estrogen is also responsible for maintaining the body's thermostat to normal levels. So, the moment estrogen goes down, the thermostat starts going up, control is lost. This leads to random episodes of increased body temperature, and increased body temperature से hot flashes होते हैं. ये हॉट फ्लैशेस को ही हम कहते हैं हो रहे हैं ईस्ट्रोजन विड्रॉवल की वजह से. विड्रॉवल मतलब द बॉडी वाज यूज्ड टू हैविंग ईस्ट्रोजन विद इट फॉर अ लॉन्ग पीरियड ऑफ टाइम टिल द एज ऑफ 50. उसके बॉडी में ईस्ट्रोजन था, बट नाउ सडनली देयर इज नो ईस्ट्रोजन एंड दैट लीड्स टू दिस हॉट फ्लैशेस. यू वुड आस्क मी कि सर फिर ये हॉट फ्लैश तो पूरा दिन होना चाहिए क्योंकि मेरे पूरे दिन बॉडी में ईस्ट्रोजन नहीं है. रिमेंबर दैट इन योर बॉडी योर पेरिफेरल फैट आल्सो प्रोड्यूसेस ईस्ट्रोजन, बट इट इज secreted in very low amounts. So those low amounts are not adequate enough to maintain that thermostat in the normal range, and hence estrogen withdrawal majority जो ओवरी से बनता है उसके कम होने के वजह से I am going to have thermostat का derangement. Now this derangement is leading to multiple episodes of increased body temperature. So, what do I do for this? How do I treat it? The treatment, सबसे पहले मैंने बोला था मैं बात करूंगा नॉन मेडिसिनल. बेसिकली लाइफस्टाइल मॉडिफिकेशंस पे पहले फोकस करेंगे. लाइफस्टाइल मॉडिफिकेशंस में आई एम गोइंग टू टेल हर कि सबसे पहले देखो तेरा बॉडी का टेम्परेचर कम करना है, सो हैव अ कोल्ड वाटर बाथ. Basically have a cold water bath twice a day so that your body feels cold. Wear light colored and thin clothing. Don't wear woolens and all. This will help your body breathe. Your skin will be able to breathe as well and it will stay cooler. Hydrate yourself. Increase the hydration of your body. Body का hydration levels maintain करो. And do yoga. Yoga also has shown to affect the thermostat in a positive way. Positive way यानी in a good way. So yoga practice करो, थोड़ा सा करो, ये तुम लोग को benefit होगा. Now these all are good methods, but these methods don't really work always. A few people are benefited, a few people feel no, it is not working on me. In that scenario, I will go ahead and I will start her treatment with medicinal methods. मेडिसिनल में भी पहले आएगा नॉन हार्मोनल. नॉन हार्मोनल में I have a few drugs. Those drugs I'm only going to be mentioning at your level. The names of it you all don't need to know how do they work. One drug is clonidine, which is an alpha 2 agonist. It basically reduces the sympathetic drive. The next drug is going to be in this scenario SNRI and SSRI. Now, these are antidepressants. We use these drugs in patients with depression as well. इनका काम क्या है? ये लोग serotonin और norepinephrine का levels बढ़ाते हैं. न्यूरोमस्कुलर जंक्शन ये जो होता है, ये जो न्यूरल जंक्शन होते हैं, साइनेप्स होता है, यहाँ पे ये सब न्यूरो ट्रांसमीटर्स होते हैं लाइक serotonin and norepinephrine. यहाँ पे there are receptors which take these up and put it inside the neuron. Once they go inside the neuron, they are not freely available, and then my body starts feeling that I lack serotonin and norepinephrine. This is exactly what happens in patients with depression. So to ensure that these neuroreceptors stay in this space, ये दो nerves के बीच के space में intact रहे, what do? I do I block these receptors. ये अगर receptors को block कर दिया तो यहाँ पे इनका availability बहुत भर भर के रहेगा, and this is what is called as serotonin norepinephrine reuptake inhibitors. Reuptake मतलब वापस अंदर लेने से उसको रोक रहा है, and SSRI is selective serotonin reuptake inhibitor. So it is not taking it up and it is lying freely over here, and hence my body knows now that I have adequate amount of serotonin and norepinephrine. So this drug is going to help her have a better mood throughout the day. Depression वाले जो है chances वो कम होंगे. What are the drug names? Paroxetine है, escitalopram है. Escitalopram is the commonest drug that we give daily on a daily basis to patients with this disorder. And venlafaxine. कोई भी एक याद रखो काफी है. Also, there is something called as a gamma aminobutyric acid. It's an inhibitory neurotransmitter. Inhibitory मतलब body को वो inhibit करता है, relax कराता है. उसके agonist जो होते हैं, these are what we use in neuropathic kind of pain. जो sciatica रहता है, उसमें हम लोग इसको use करते हैं. Example है gabapentin या pregabalin. Gabapentin एक drug का नाम याद रख लो. Fine. I gave this female all these things. She just came back to me and said, "Sir, it is not working on me. I'm just not feeling good enough yet." That is when I tell her, "Sorry, ma'am, I have no option now but to start you on hormonal drugs." She asks me, "But why, sir?" I will tell her, "तेरे body में hormones की कमी है. I can only correct that by supplementing you with more hormones." So I can either give her just estrogen or I can give her estrogen with progesterone. Now I have to make a choice between सिर्फ estrogen देना है कि सिर्फ estrogen and progesterone देना है. Obviously बात है, giving just one hormone is always going to be better than giving two hormones, क्योंकि एक hormone का side effects are okay, दो hormone का side effects are not okay. But still, estrogen plus progesterone is the one that we give. Why? Remember, I have a uterus as well inside me. This uterus, if is receiving only estrogen, this will lead to endometrial hyperplasia. यहाँ पे hyperplasia होगा, और ये hyperplasia because estrogen is the one that helps in proliferation of your endometrium. So once this endometrium proliferates excessively, remember what happens in your normal menstrual cycle. In the first 14 days, estrogen thickens your endometrium, and in the next 14 days, progesterone maintains it, and at the end of your cycle at day 28 there is no estrogen, there is no progesterone, and hence all of this sheds out. But इसको कहते हैं प्रोजेस्टेरॉन विड्रॉल. बट दिस डज नॉट हैपन इन पेशेंट्स जिनको हम प्रोजेस्टेरॉन दे नहीं रहे हैं. सो देयर विल बी अनअपोज्ड ईस्ट्रोजन इन द बॉडी. अनअपोज्ड ईस्ट्रोजन से क्या होगा, बहुत ज्यादा थिक बनेगा एंडोमेट्रियम, सो थिक दैट यू कैन गिव द फीमेल बाय मिस्टेक एंडोमेट्रियल कैंसर. So to prevent endometrial cancer, we give these women estrogen and progesterone together. Of course, progesterone has its own side effects, but यहाँ पे the benefits of giving progesterone are more than the side effects. So in which patient would I prefer only estrogen? In those patients who do not have a uterus. So those patients in whom I have removed the uterus by hysterectomy for some reason a few years ago. So in females who do not have a uterus, they are going to be candidates for receiving only estrogen. Whereas in the rest of the patients, I'm going to be giving estrogen and progesterone. There are two ways of giving this. Now we call this as HRT. HRT is hormone replacement therapy. Basically, I'm replacing the hormones by giving them बाहर से. मेरे body में तो बन नहीं रहे, तो बाहर से दे रहा हूँ मैं. So how do I give it? I have two ways of giving it. I can either give it combined यानी मैं दूंगा उनको ईस्ट्रोजन एंड प्रोजेस्टेरॉन दोनों एक साथ 28 दिनों के लिए, और आई कैन गिव इट सीक्वेंशियली. सीक्वेंशियली मतलब मैं ईस्ट्रोजन दूंगा फर्स्ट 14 डेज में और अगले 14 डेज में मैं प्रोजेस्टेरॉन दूंगा. So basically this will mimic my natural cycle. I can give both of them. It's a good way. What do I prefer? I can prefer both. The problem is that ये जो इंडिविजुअल ईस्ट्रोजन मिलता है वो बहुत महंगा है. 600-700 रुपए का एक पैकेट आता है. Whereas estrogen plus progesterone का ये जो कॉम्बिनेशन है, ये गवर्नमेंट गिव्स अस फॉर फ्री, कॉल्ड एज माला एन और माला डी. This is something that is freely available in a government setup, and hence this can be given. The disadvantage is that this has to be given continuously, whereas this can be given at a break. मतलब ये 14 दिन के बाद when you stop giving progesterone and you start again giving estrogen, the female will have progesterone withdrawal and she will bleed. So these women are going to even menstruate sequential wale every month, and that is how I'm going to be giving HRT. Are there any other ways I can give HRT apart from tablets? Yes, I can give it in the form of a trans डर्मल पैच, बेसिकली एक स्किन पे पैच लगाते हैं हम जहां से वो एब्जॉर्ब होता है ड्रग, और आई कैन गिव हर इन द फॉर्म ऑफ अ वजाइनल सपोजिटरी और अ वजाइनल क्रीम जहां से वो एब्जॉर्ब होना शुरू होगा. एंड दैट इज हाउ आई ट्रीट vasomotor symptoms of menopause, VSM. ग्रेट. ये हो गया मेरा पहला सिम्टम आज का. ग्रेट. नेक्स्ट. ओ बाय द वे, इफ these are very high fundu topics, these topics are those that I understood in depth only in my post graduation. So you all might find it difficult. Do not worry. Reach out to us. You all have my number already on the WhatsApp group. If you all don't, Dr. Viren and Dr. Sanya are doing a fabulous job of leading this startup. Startup ही बोलूँगा यार, अभी इतना बड़ा बन चुका है. It's a startup. Magnum Opus is a huge startup in causing revolution in OBG, in homeopathy teaching. But yeah, so Dr. Viren and Dr. Sanya are of course easily accessible to you. So if you have any doubt, you can run it through them. They will reach me eventually and I will answer them. So do not worry. If you all have any doubts, please message me personally or through Dr. Viren and Dr. Sanya. Next. The next symptom or the next syndrome is going to be पहले था vasomotor syndrome of menopause. अभी है genitourinary syndrome of menopause. Okay. Now, what are the signs and symptoms? Signs and symptoms include genital itching. So basically perineal area में बार बार patient खुजाता रहेगा. They will have multiple itching episodes, very socially embarrassing. They will have vaginal dryness. How would they know of dryness? They will tell you that every time I have coitus with my partner, it feels very dry. Earlier, I used to get my natural lubrication through my Bartholin's glands. Of course, I'm the one who knows that it is Bartholin. She doesn't know. But yeah, Bartholin से निकलता था, skin's gland से थोड़ा बहुत आता था. But now I don't feel anything. It is very painful for me. Every time he penetrates, I experience a lot of dryness and a lot of pain, and hence I cannot have coitus. So vaginal dryness. Females will say they are having burning micturition. That whenever I pass my urine, I am having excessive burning. Burning micturition बहुत जोर से हो रहा है. They will also say that I feel like going to the washroom, to the loo, to pee multiple times. So urinary urgency and frequency both are increased. Apart from that, what I've already said, dyspareunia. Dyspareunia is painful coitus. So डिसयूरिया भी ऐड कर देता हूँ, मतलब पेनफुल यूरिनेशन. सो पेनफुल coitus, painful urination, burning micturition, genital itching, all the things that involve your vulva, urethra, vagina, everything are going to fall under genitourinary syndrome of menopause. Again, why is this happening? The cause is that when the estrogen was there in your body, the estrogen served one more purpose. It is to maintain the epithelial lining. It is to keep it healthy across my body. Epithelial lining को healthy रखता था. इसका क्या मतलब है epithelial lining को healthy रखता था? You see that older women, you compare a man who is 60 and you compare a female who is 60, you would see that the female has a lot more skin wrinkles. The reason is that your estrogen is a very important hormone for maintaining your collagen and elastin नाम का जो fibers होता है in your skin and connective tissue. ईस्ट्रोजन जब कम होगा मेनोपॉज के बाद तो कोलेजन कम होगा, इलास्टिन कम होगा. इफ द कोलेजन reduces, the texture of your skin is going to reduce. इलास्टिन reduce होने की वजह से your skin is no longer elastic, it becomes very rough and tough. This leads to wrinkling. Collagen खत्म हो गया, elastin खत्म हो गया. This leads to wrinkling of your entire body skin. This, if it happens, and it will happen in the vulval region, this will lead to continuous itching. We also say that the vagina is so wrinkled that it has a parchment paper kind of a feel. It basically feels like paper that will just come off if you try to peel it. It can be very painful. You will even see that the vulva is peeling off at multiple locations. Labia majora, the skin निकल रही है. This is all because of the lack of estrogen. So this estrogen is very important in keeping the epithelial lining healthy. The same epithelial lining which was present in all the skin and vaginal mucosa is the same epithelial lining that is present in your urinary tract. In your urinary tract, you have an epithelium called as the urothelium. Similarly, just like the skin, even the urothelium is going to be affected. It is going to be affected because of the lack of estrogen. Whenever there is urothelial damage, that will lead to your burning, micturition, recurrent UTIs. Remember, your epithelial lining, ये जो आपका यूरेथ्रा है ऐसा, और उसके अंदर का अगर epithelial lining की बात करूंगा, this epithelial lining is going to be, ये है normally और ये है menopausal में. मेनोपॉजल में वो ऐसा डिरेंज हो गया, ऐसा दूर दूर हो गया, खराब क्वालिटी का हो गया. सो यहाँ से बैक्टीरिया कैन एंटर योर बॉडी. सेम वे इट कैन एंटर योर बॉडी. दिस विल ऑल्सो लीड, यहाँ से जब यूरिन पास होगा तो यहाँ पे बर्निंग, मिक्चुरेशन होगी. यहाँ पे जो नर्व एंडिंग्स होंगे वो नर्व एंडिंग्स एक्सपोज होने लगेंगे. सो देयर इज गोइंग टू बी pain, burning during urination. Also there are going to be possibilities of multiple recurrent यूरिनरी ट्रैक्ट इन्फेक्शंस, बिकॉज ये एपिथेलियम जो था, यूरोथेलियम, ये पूरा डैमेज हो चुका है इन द ब्लैडर एंड यूरेथ्रा. दिस इज व्हाट लीड्स टू जेनाइटो यूरिनरी सिंड्रोम ऑफ menopause. How do I treat it? The treatment again is going to be first of all नॉन मेडिसिनल में मुझे पेशेंट बोलते हैं मुझे मेडिसिन हार्मोनल नहीं चाहिए, मुझे मेरा सेक्सुअल लाइफ अच्छा करके दो. So I tell her start using artificial lubricants, oil-based lubricants use karo, they are safe. And if you feel that your vagina has become very narrow because of the wrinkling, you can then also use a vaginal dilator. You start using a vaginal dilator. छोटा साइज से लेके जाड़ साइज तक ऐसे आता है, जितना तुम्हें चाहिए उतना साइज मिलता है. So start with the lowest possible size and then keep on increasing it. And once you have it of an appropriate length, then you can again start enjoying your coital activity. Don't worry about it. So vaginal dilators, lubricants तो वजाना के अंदर. बाहर के स्किन के लिए क्या, बाहर के स्किन के लिए you get special pH balanced moisturizers. vaginal moisturizers, vulval moisturizer, अंदर नहीं लगाना है, बाहर से लगाना है. So all these things are what you're going to be giving. Apart from that, if she still says that sir मैंने बहुत ट्राई किया लेकिन नहीं हो पा रहा है, give me something medically, then I will ask her that there are not too many non-hormonal options. One of the non-hormonal drugs that I have is DHEA. Now, DHEA is the testosterone that is secreted by the adrenal glands. It's a very less powerful, it's a very weak testosterone ka form, weak androgen, but it is important because it is still having some androgenic activity. So, इसकी tablets मिलती है. सो बेसिकली मैं ये फीमेल को एंड्रोजन के टैबलेट्स दे रहा हूँ. क्यों? आई हैव ऑलरेडी मेंशन्ड दैट एंड्रोजन्स टेस्टोस्टेरोन जैसे आर रिक्वायर्ड फॉर लिबिडो. So by giving this, at least her libido will increase and she will have the motivation to use those lubricants and vaginal dilators. But apart from that, I do not have too much of non-hormonal therapy for her. In hormonal, I have many options. Again, I have either estrogen or estrogen plus progesterone. उसमें भी मेरे पास क्या क्या फॉर्म्स है. I can either directly insert it inside the vagina by using a cream or a jelly, whatever is convenient. Remember, cream and jelly से बहुत ही ऐसा चिपचिपा हो जाता है, so not a lot of people prefer it. So for the ones who do not prefer it, I can even give them suppository. Suppository or vaginal tablets. So vagina के अंदर weekly twice tablet रखना है, या फिर ओरल दे दो. जैसे हम यूजुअली देते हैं, या फिर ट्रांसडर्मल पैच दिया करो. बट द प्रेफर्ड वेज आर गोइंग टू बी जेली एंड क्रीम, सपोजिटरी ज्यादा प्रेफर्ड, एंड ओरल सबसे ज्यादा प्रेफर्ड. एंड दैट इज हाउ आई एम गोइंग टू बी ट्रीटिंग योर जेनेटो सिंड्रोम ऑफ मेनोपॉज. ऑफ कोर्स अपार्ट फ्रॉम दैट, बार बार यूटीआई हो रहा है तो यूटीआई को ट्रीट करो, यूरिन अल्कलाइजर दो. सिटाल नाम का एक सिरप आता है, यू कैन गिव दैट, गिव देम एंटीबायोटिक्स एज पर यूरिन कल्चर सेंसिटिविटी. Treat the UTI. Of course, you have to treat the UTI, then only all these therapies will work. I had mentioned that I'll be telling a special drug. So the special drug for this one is going to be ospemifene. Ospemifene is a special class of drug called as selective estrogen receptor modulator. So basically ये कुछ जगहों पे ईस्ट्रोजन को एगोनिस्ट बनेगा. तो कुछ जगहों पे इट्स एन ईस्ट्रोजन एगोनिस्ट. एगोनिस्ट मतलब उसके फेवर में काम करता है, और कुछ जगह पे इट्स एन ईस्ट्रोजन एंटागोनिस्ट. So it's an estrogen agonist in the hypothalamus. So basically hypothalamus में जाके it makes me believe, my brain believe that मेरे body के अंदर adequate estrogen है, whereas it's an estrogen antagonist in the uterus. Because if it's an antagonist, then the endometrial lining will not increase, and that will avoid getting endometrial cancer. So ospemifene is the drug. The special drug for the above discussion, which vasomotor symptoms of के लिए था, यहाँ पे मैंने बोला नहीं था. The special drug was bazedoxifene, similar action. Again, an SCRM, bazedoxifene. So that is it about genitourinary syndrome of menopause. Coming to the third syndrome. The third syndrome happens to be a very important syndrome. Again, it's a continuation of genitourinary syndrome of menopause. We call this sexual dysfunction. Sexual dysfunction is basically the female has lost her libido. क्यों? क्योंकि उसके बॉडी में टेस्टोस्टेरोन भी कम है, उसके बॉडी में ईस्ट्रोजन भी कम है. So what are the symptoms and signs that this female has? Physically, this female is going to have, of course, genitourinary syndrome of menopause wale sub symptoms, and again dyspareunia, बहुत ही important. She will say that every time my partner enters me or penetrates me, I am experiencing excessive pain. Whereas mental agony बहुत होगा, that she is no longer able to have coitus. Her partner is probably not understanding enough and is saying her mean stuff because she is not able to have coitus with him. So that will lead to her losing her sleep over it. So again, she's going to be deprived of her sleep because she's thinking about it again and again. Insecurity strikes that probably my husband will look elsewhere for the coital act. सो स्लीपलेसनेस होता है. ये स्लीपलेसनेस के वजह से उसको फटीग होता है. फटीग के वजह से फिर से उसको हॉट फ्लैशेस एंड ऑल स्टार्ट होते हैं. सो अगेन मेमोरी लॉस होना शुरू होता है, एंड द फीमेल लूजेस हर इकोनॉमिक प्रोडक्टिविटी. सो सेक्सुअल डिसफंक्शन इज वेरी इंपॉर्टेंट. Basically, a female is affected mentally as well as physically. All this will lead to depression. How do I treat this? I need to increase her arousal levels. Arousal levels में increase कर सकता हूँ multiple ways से. So what are the treatments available? In treatments, again, non-medicinal में आता है, उसको पहले तो दे दो lubricants, same way with dilators if she feels that her vagina has constricted. Non-hormonal में, because she is not feeling great about herself, she is feeling very low, डिप्रेशन में है, जिसके वजह से उसका लिबिडो और कम हो रहा है, गिव हर एंटी डिप्रेसेंट्स, SSRIs एंड SSRIs, the ones that I spoke of earlier. In hormonal, I will give her multiple options. ईस्ट्रोजन प्लस प्रोजेस्टेरॉन तो दूंगा ही, या फिर ईस्ट्रोजन, उसके साथ में उसको टेस्टोस्टेरॉन भी देना चाहूंगा. टेस्टोस्टेरॉन किस फॉर्म में मैं देना चाहूंगा? मल्टीपल फॉर्म्स. एक है DHEA के टैबलेट्स मिलते हैं, वो देना चाहूंगा. वीक फॉर्म ऑफ टेस्टोस्टेरॉन है, बट काम चल जाता है. द प्रॉब्लम इज दैट एक्सेसिव टेस्टोस्टेरॉन दोगे तो पेशेंट को विरिलाइजेशन होगा. विरिलाइजेशन इज बेसिकली द फीमेल विल स्टार्ट लुकिंग लाइक अ मेल. टेस्टोस्टेरॉन देने की वजह से मेल मतलब उसका देयर इज गोइंग टू बी hoarseness of voice. The voice is going to be like a baritone, like the one that I'm talking in right now. Apart from that, the female can also have masculine symptoms like hirsutism. She can have masculine facial hair, that are present on her. She can have clitoromegaly. Her clitoris starts becoming longer to mimic the penis of a man, and her body build is going to start looking like a man, which is why I have to be very careful while giving all these drugs. स्पेशल ड्रग मुझे वही यूज करना है जिससे उसका मूड बेटर होगा. तो स्पेशल ड्रग में मेरे पास मूड अच्छा करने के लिए कौन से ड्रग्स है? एक है फिबानसेरिन. फिबानसेरिन इज अगेन अ सीरोटोनिन को इंक्रीज करेगा. अपार्ट फ्रॉम दैट आई हैव सिल्डेनाफिल. सिल्डेनाफिल जिसको वायग्रा बोलते हैं, फीमेल का डोसेस कम है. वायग्रा ये सब का काम एक ही है, टू इंक्रीज द ब्लड सप्लाई टू एवरी ऑर्गन इन द बॉडी इंक्लूडिंग योर clitoris and your vagina, vulva wale part. So basically your reproductive organs are going to receive a lot more blood supply due to vasodilatation that sildenafil causes. Sildenafil Viagra. Viagra करता क्या है? How does it correct erectile dysfunction? It increases the blood supply to the penis, जिसके वजह से the penis can increase in size. How does it do it? It does it by dilatation of the vessels. So these are the two drugs that you're going to be using. And that finally brings me to the last but the most important syndrome that all of you know, osteoporosis. Osteoporosis, very important, बहुत females को होता है. So याद रखना है, in ortho you will learn there is something called as a rank ligand. This rank ligand increases bones में the activity of osteoclasts. There are osteoblasts and there are osteoclasts. ये osteoclast का काम होता है बोन का रीएब्जॉर्प्शन बढ़ाने का. रीएब्जॉर्प्शन मतलब क्या? बोन से कैल्शियम को खींचने का बाहर. दिस विल मेक द बोन्स वीकर. सो उसका ये काम होता है, कैल्शियम को खींचने का बोन से. ईस्ट्रोजन जो है वो रैंक लाइगेंड को इनिबिट करता है. इस इनिबिशन की वजह से ऑस्टियोक्लास्ट का भी एक्टिविटी कम होता है, बोन रीएब्जॉर्प्शन कम होता है, एंड ईस्ट्रोजन leads to increased bone mineralization. So basically bone का calcium content बढ़ाता है estrogen. But similarly, when there is lack of estrogen due to menopause, there is going to be increased bone absorption and that will lead to osteo, that is bone porosis. Pores are being formed in it. Basically, the bone weakens due to increased rank ligand activity due to lack of estrogen. ठीक है. What are going to be the signs and symptoms? The signs and symptoms are going to be chronic back pain. There are going to be stress factors, fractures. Stress fractures are basically small microscopic fractures that are occurring on areas जिस पे ज़्यादा stress रहता है, like a lumbar vertebra. उसमें stress fractures होंगे. You are going to have easy fracture potency. Basically, easily fracture होगा कौन सा? Head of femur. या फिर नेक ऑफ फीमर का फ्रैक्चर्स बहुत कॉमनली होता है. मतलब पेशेंट थोड़ा सा ही गिर गया नीचे और उसका वो हड्डी टूट गया. अदरवाइज अ यंग पर्सन, if they fall they don't end up breaking their hips, but these women, elderly women, can end up having their neck of femur fractures. So how do I treat it? The treatment needs to be understood well. Remember that ये जो rank ligand का मैंने बताया, bone reabsorption, apart from your estrogen there are several other hormones that affect it. So first of all I have to correct all other medical comorbidities. So medical comorbidities को correct करो जिससे calcium metabolism derange हो रहा है. What are they? Hypo या hyperthyroidism को correct करो पहले. Similarly hyperparathyroidism को correct करो. Next, CKD, chronic kidney disease को correct करो because kidneys are the place which initiate your absorption of calcium. Correct malabsorption syndrome if you have. Check whether the person is consuming steroids for autoimmune disorders because steroids से भी यही similar action होगा. Apart from that, if a person is having rheumatoid arthritis, SLE, जिससे bone weakening हो रहा है, तो ensure करो कि drugs देके you are bringing down their disease activity. Once this is done, I will move to management. तो नॉन मेडिकल में मैं उसको सबसे पहले बोलूंगा कि स्मोकिंग कम कर, क्योंकि स्मोकिंग से क्या होता है? स्मोकिंग इज गोइंग टू इनिबिट aromatase enzyme which is useful in the production of estrogen. So smoking कम करो. Apart from that, स्मोकिंग कम करने के अलावा और क्या क्या करना है तुम्हें? डू वेट बेरिंग एक्सरसाइजेस. सो बेसिकली वेट बेरिंग एक्सरसाइजेस यूट्यूब पे ही तुम्हें वीडियोस मिलेंगे वेर इन एवरी बोन ऑफ योर बॉडी इज टॉट टू रेजिस्ट मोर वेट, टू बी एबल टू बैलेंस मोर वेट. तो वेट बेरिंग एक्सरसाइजेस को तुम्हें इंक्रीज करना है. अपार्ट फ्रॉम दैट अल्कोहल इंटेक को कम करना है. अल्कोहल इंटेक को कम करना है और डाइट में विटामिन डी एंड कैल्शियम बढ़ाना है, इंक्रीज करना है. दीज आर द नॉन मेडिसिनल वेज. अपार्ट फ्रॉम दैट मेडिसिनल वेज में क्या क्या ऑप्शंस है मेरे पास. मेडिसिनल वेज में मेरे पास मल्टीपल ऑप्शंस रहने वाले हैं. वो मल्टीपल ऑप्शंस होने वाले हैं. सबसे पहले तो मैं उसको दूंगा कैल्शियम टैबलेट. कैल्शियम रोज कितना दूंगा? द आइडियल डोज इज 1.2 ग्राम पर डे. सेकेंड में उसको दूंगा विटामिन D3. हाउ मच? आइडियली 1000 इंटरनेशनल यूनिट्स पर डे. व्हाट्स नेक्स्ट? उसको मैं बोलूंगा विटामिन डी ले, कैल्शियम ले. अगर उससे भी काम ना बने तो मैं तुझे स्टार्ट करना चाहूंगा बिसफॉस्फोनेट्स पे. बिसफॉस्फोनेट्स reduce phosphonates, yeah, they reduce the activity of my rank ligand as well as osteoclasts. So bisphosphonates लेगी तो कौन से है? alendronate. Just remember the names. These are very dangerous drugs. They have to be given only by an orthopedic person. Zolindronate because they can lead to dangerous complications. मैं अभी उसकी बात नहीं कर रहा हूँ. प्रॉपर फार्माकोलॉजी है. ऑस्टियोनेक्रोसिस ऑफ जॉ एंड ऑल हो सकता है. अपार्ट फ्रॉम दैट आई कैन ऑल्सो गिव हर रैंक लाइगेंड का एंटागोनिस्ट. बेसिकली उसका काम ही ईस्ट्रोजन का था टू इनहिबिट दिस. तो इसको एंटागोनिस्ट कौन रहेगा? बेसिकली इसको इनहिबिट कौन करेगा? एंटागोनिस्ट डिनोसुमाब. These are the non-hormonal medications. In hormonal, what do I give? Same thing. Estrogen or estrogen plus progesterone, which is a special drug that we give over here, very famous. The special drug that we give over here is going to be raloxifene. Again, an SERM, raloxifene. Again, an SERM drug है. SERM drug है. यहाँ पे it binds bone पे. It's the agonist of estrogen. Uterus पे it's an antagonist. And hypothalamus पे again it is agonist. So selective action है इसका raloxifene. इसको याद रखना है तुम्हें. One last question, how do you diagnose कि osteoporosis हो रहा है? Osteo fracture तो वैसे भी हो सकता है, stress fracture भी वैसे भी हो सकता है, but how do you know it is because of osteoporosis? So the diagnosis of osteoporosis is very important. For that we have to do DEXA scan, dual X-ray absorptiometry. You do it of two joints. One is the hip joint and one is of the lumbar or the lumbosacral joint. Then you have to look at the scores. You have two scores. You either have the T score or you have the Z score. T score is basically T for 30. 30 years की एक फीमेल का बोन डेंसिटी. डेक्सा स्कैन का काम है बोन मिनरल डेंसिटी मेजर करना. मेरा बोन में कितना डेंसिटी है कैल्शियम का, वो मेजर होगा. तो टी स्कोर इज एक 30 ईयर ओल्ड फीमेल से कंपेयर अगर मैं करूंगा, 30 ईयर्स की फीमेल से कंपेयर करूंगा बोन मिनरल डेंसिटी उसका, तो मेरी पेशेंट जो 50-60 साल की, उसका कितना है बोन मिनरल डेंसिटी. वेयर जेड स्कोर इज मैं उतनी ही उम्र का जितनी मेरी पेशेंट है उसके अगर कंपैरिजन में देखूंगा तो कितना बोन मिनरल डेंसिटी. तो सेम एज का बोन मिनरल डेंसिटी ऑफ अ नॉर्मल फीमेल कितना है जिसको ऑस्टियोपोरोसिस नहीं है. सो जेड स्कोर इज अ बेटर स्कोर ऑफ कोर्स क्योंकि वो उसी एज को कंपेयर करता है. व्हाट आर द स्कोर पॉसिबिलिटीज? द स्कोर पॉसिबिलिटीज आर +1 से लेके -1 इज नॉर्मल. -1 से लेके -2.5 is osteopenia. Osteopenia is basically my bone is becoming weak, but it is not completely gone. Penia is lesser or deficiency of calcium in the bones. Whereas -2.5 से अगर बड़ा निकला कुछ भी, उससे भी कम, -2.5, -3, -4.5, we call it osteoporosis. ये रिपोर्ट में सब दिख जाता है. And that is how you diagnose osteoporosis on a Z score or a T score of less than 2.5. मतलब -2.5 से नीचे चाहिए. And that is how you would be able to manage your patients with osteoporosis. And with that, I would want to conclude the session on menopause. A few special questions. The special questions include what are the various regimens and all. You all don't need to remember the drugs, they're very complex. Cardiovascular system का क्या? Cardiovascular system, they say, if you initiate your hormone replacement therapy within 10 years of menopause, then it is going to benefit your heart and your blood vessels. But if you initiate hormone replacement therapy after 10 years of menopause, then it is going to have a detrimental effect, and in fact, it will lead to myocardial infarction, ischemic heart disease, and all complications. And apart from that, it is also going to worsen females who have dementia or Alzheimer's, so avoid using it in them. And breast cancer के patients में progesterone avoid करना है क्योंकि progesterone से alveolar या ductular cancer के chances बढ़ने वाले हैं. So this is it about menopause from my end. I hope you all understood the session. If you all have any doubts, do ask us, do ask me or Dr. Viren or Dr. Sanya. We will answer them on the group. And with that, this is Dr. Aditya signing off from Magnum Opus. I shall see you in more sessions in gynecology. Until then, keep watching Magnum Opus. This is me signing off. Thank you.